Hi guys, Luke here, MTP Health. Just wanted to go through something that we get all the time in the clinic is people with arthritic knees or with joint pain asking about stiffness or tightness and why there isn't a lot of stretching involved in their program. And fundamentally it comes down to kind of delineating between those two terms, one being stiffness and one being tightness. Tightness, we would suggest that the muscle's tight, something needs stretching and it'll feel better. That's often the case if you've been exercising a lot, if you've been working out and you're feeling a bit restricted and you feel like you're stiffening a little bit, getting a bit tighter, then a stretch or a roll or a massage or something will help with that quite a bit. The feeling of stiffness, or how we would define stiffness, and particularly with people with arthritic change, is when your brain says or senses a risk involved with a movement and it says, I don't know, I don't really want you to hurt me, I feel like we should make that more secure, and it just clamps down on the area. And you get a lot of that around the hip, you get a bit around the knee, you often get it around the spine, it can happen at the shoulder, where the deeper muscles, the deep stabilizer muscles grip on and start as a response to instability, to lack of control. So what we end up doing then is layering more control, more strength and more activation over the top of that. Feels counterintuitive when you first do it because you're like, man, this is right on the spot that hurts. Why am I working this area out? I want to stretch it. But when your nervous system is going, you could hurt me, clamp down on the area to make it secure, and then you stretch it, you just undo that security blanket, and as soon as you do something, it feels wobbly and it clamps back up again. And you get this sort of merry-go-round of releasing soft tissue and then doing something and it clamping down, and then releasing soft tissue and doing something and clamping down. The solution long-term is to stabilize the area, make it more secure consciously rather than letting it just happen automatically, and then that stiffness will subside. It doesn't happen immediately, but it definitely happens as you get stronger and more control. The other upside in terms of arthritic joints is that when you start to stretch or compress or get into weird angles of stretching with arthritic joints, they tend to get a bit angry with that. So to reduce the vulnerability of irritation, we prefer to add stability as a mechanism for reducing the stiffness. So think tightness needs a stretch, stiffness needs a strengthen. Hope that helps. Speak to you soon.